Welcome back to the Now Morning Show. We're starting off our conversation this morning in observation of World Glaucoma Week. The theme is Uniting for a Glaucoma-Free World, celebrated from March 10th to 16th. In studio with us this morning, we have Dr. Raj Rishi Sharma, president of OSWI. We'll get to that in a little bit. And also joining us, we have Dr. Nilesh Prasad, secretary of OSWI as well. Good morning, doctors, and welcome.
Good morning.
Morning. Thank you.
Thanks for having us here.
It's a pleasure to have you with us on the show this morning. So before we go any further, let's get the correct pronunciation of OSWI.
OSWI is the Ophthalmological Society of the West Indies.
Excellent. Thank you so much for that. Now, let's get straight into the conversation this morning of glaucoma. Dr. Prasad, we were talking about, I was sharing with you my personal experience as somebody with glaucoma, and also not having that awareness, because there's the assumption that somebody will go blind at the end of the day. But you shared that that's not the case. So let's get into what is glaucoma first and how it affects the eyes.
Well, what is really important to understand is what is glaucoma. So that's an excellent question, and that's a question a lot of patients often ask and are a bit confused about. So glaucoma is really a condition where the pressures within the eye is a bit higher than normal, and it damages the nerves in the eye. So I want you to understand that the eye produces fluid and drains it out.
Okay.
Now, if you think about it, if there's a little blockage in the drainage of the fluid builds up in the eye, the pressure increases in the eye. And when that happens, that could eventually lead to the optic nerve being damaged. And when the optic nerve is damaged, that's the nerve that goes from the eye to the brain. It now decreases your vision. And it's a very progressive disease that over time causes ultimately blindness. And one of the things that is so important about Glaucoma Week and Awareness Week is we want people to understand this is a condition that you can catch early, you can stop, you can prevent by proper treatment.
Okay, interesting. Now, we need to get back into that conversation when you mentioned especially the pressure behind the eye, because the first thing that comes to mind, of course, is high blood pressure. But the next thing that comes to my mind immediately is, do we not feel that pressure behind our eye building? So how do we diagnose glaucoma, Dr. Sharma?
So yeah, because as Dr. Prasad said, the pressure builds up gradually and it's a progressive condition. Patients are often asymptomatic of the condition. In fact, it's nicknamed the silent thief of sight.
Wow.
Because you lose your sight over a period of time without knowing it. And it's only when you present with vision problems that you realize that you have the condition. It's very straightforward to diagnose in most cases. You do need to be seen by an eye care professional who can have a look into the eye and examine the optic nerve. As we were hearing, the optic nerve is the nerve that's damaged in glaucoma. And we can also measure the pressures in the eye. And if we keep a monitor on patients with glaucoma, as has been said, it's very rare that they will lose their eyesight and go blind. And if we can screen people and pick up the condition early, we can keep most patients seeing with good vision for the longevity of their lives.
And that's excellent news to hear, especially with screening, of course, and treatment. So, Dr. Prasad, how do we treat with glaucoma?
Well, there's a variety of treatments available for glaucoma. And we have them in, you could say, in different stages, right? The most common treatment used worldwide is drops,
okay,
right? And we have a variety of drops that you can put daily in the eye, which reduces the pressure. Because this is a pressure-related problem. I want you to understand, if we reduce the pressure, we can address the problem.
Okay.
Right? So we want to keep the pressure within normal limits, and this is achieved by a variety of measures. And as I said, the first port of call is often drops. But with newer technology now, we have certain types of lasers that also decrease the pressures, which keep you a bit drop-free over a certain period of time. And then if things progress and that is not satisfactory, then we have a wide variety of surgical management, which has been shown to be quite effective in reducing the progression of the disease.
Excellent. Good. And the drops is something I think we all know is the norm, but it's wonderful to hear about the laser and to hear about surgical options as well. Although admittedly it can be a bit intimidating for some people, right? Let's be frank about it. But it really is so effective. Now let's talk about we've heard this word pressure, I think probably at least 5 times in our conversation this morning. So let's talk about the possible relation, or the relation, Dr. Sharma, between diabetes, high blood pressure and glaucoma.
Yes, well, in diabetes and high blood pressure, which are very prevalent conditions in our society, one of the problems that they cause is they damage blood vessels in the eyes and in the body as well. if you have raised pressure in your eye that's compressing tissues, and you have compromised blood vessels from diabetes or blood pressure, then of course it can cause more damage to those vessels, and so the blood supply to tissues will be impaired further. As a result of that, people with diabetes and glaucoma diabetes and hypertension, raised blood pressure, can have progression in their glaucoma that's faster than might be expected, and they can present with worsening glaucoma than is normally seen in patients without these conditions. So if you do have these conditions, it's important to tell the eye care professionals that's looking at you to either diagnose or monitor you, but it's also important to take your medications and so on for these conditions, because the better control that they are, the better that will help you manage your glaucoma as well.
Okay, wonderful. Now, Dr. Prasad, just going off of what Dr. Sharma said, the next thing that I was coming to you to ask was about preventative measures. Are we looking at lifestyle changes?
Well, lifestyle changes doesn't really affect the pressures in the eye as much as we would hope to.
Okay.
Right? Realistically, as Dr. Sharma mentioned, if you need to make sure that all your blood pressure and your diabetes is under control, if you have such, because that leads to a higher incidence, meaning that there's a higher risk of glaucoma. Right. Now, one of the questions that just to point out is that often patients confuse blood pressure with eye pressure. Okay. And that is something that often needs clarification, because patients would come in and say, well, their pressure good. They do have a problem with their pressure. And we just need to make that clarification that the blood pressure is different from the eye pressure. And while there is a relation, there's no direct correlation.
Interesting.
Right? So meaning if you have a high blood pressure, it does not necessarily mean your eye pressure will be high. Right? So we just need to bear that in mind. It does contribute to the overall damage of the optic nerve, so it's good that you control everything. Other than, realistically speaking, living a good, healthy lifestyle, exercise, diet, controlling your blood pressure, controlling your diabetes has been shown health-wise to benefit everything in your body. And that's what we would like people to aim for. But probably the most important part of glaucoma is screening. Okay. Catching it early.
Something that is so critical. Now, speaking about screening and catching it early, Dr. Sharma, if we have somebody in our family who suffers from glaucoma, do we need to get checked as well? Is this something that can be passed down?
Absolutely. There's a strong genetic component to glaucoma. And there are many risk factors that one has to look out for in glaucoma. In our part of the world, people with a lot of pigment in the skin have a higher incidence of glaucoma. People who have diabetes and blood pressure, as we've said, people who've had trauma to their eyes have a higher risk of getting glaucoma. And people who have a first-degree relative with glaucoma, it has an increased risk. So we often say that if we screen the population from age late 30s, age 35, 40 and beyond regularly for glaucoma, if you have a first-degree relative, we may ask you to start screening earlier at age 30. If you have multiple first-degree relatives, then we may even screen you from earlier than that. And there are some families that carry a genetic trait for some types of glaucoma, and they can have eye problems from very early ages. And therefore, it's important that if you do have members of the family with glaucoma, that's brought out so we can screen you at an appropriate age and so pick up the condition if it's present.
Excellent. So the appropriate age really depends on many different factors.
Absolutely.
And has to be considered. But do you see a particular age group that displays signs of glaucoma more than others?
Well, I think once we cross the age of 40, it's very much more prevalent to see. And the only caveat to that is, as I said, if you've had trauma to the eyes before, if you have concurrent systemic illness, or indeed multiple first-degree relatives with glaucoma.
Okay, excellent. So before we wrap the conversation, Dr. Prasad, is there anything you'd like to share with Trinidad and Tobago when it comes to glaucoma awareness particularly?
Yes. I want people and patients especially to understand there is hope. Right? There's hope in treatment, there's hope in detection, there's hope in diagnosis. We want to ensure that patients don't lose hope if they are diagnosed with glaucoma, right? There's a chance, and there's an excellent chance picked up early that they could maintain their life, their sight for their entire existence.
Excellent. Thank you so much for that. And Dr. Sharma, any closing comments as we observe Glaucoma Week?
Yes, absolutely. Please go and see your eye care professionals and get get yourself tested and diagnosed if you have any of the risk factors I've mentioned. As I mentioned before, it is preventable blindness. It's a leading cause of preventable blindness in the world, and we should all work together to prevent our countrymen from having to suffer loss of vision or reduced vision from this condition.
Thank you so much, Dr. Sharma. Thank you so much, Dr. Prasad. It's been a pleasure to have both of you on the show this morning, and wishing you all the best as you, of course, will be observing this week, and I know you'll both probably be very busy.
Thank you very much.
Celebrating World Glaucoma Week right here on the Now Morning Show, uniting for a glaucoma-free world. Do your part, and also don't forget, if you want to, go with a friend and get your eyes checked. We'll be back in a few moments right after this short break.